It's important to start to understand the difference between a primary vaccination, which may be a series of shots, and a booster. So booster shots are intended to boost immunity that has waned over time. A booster assumes that the initial vaccination was effective. So for example, we all get a series of multiple tetanus shots in infancy. And we assume we've got immunity against tetanus, but over time, our immunity wanes gradually. So we get tetanus boosters every 10 years, not because the vaccine didn't work the first time, but just because the immune system starts to forget how to respond to that. We have long anticipated that there would likely be a coronavirus booster that might be on something like an annual basis, just based upon our response to other viral vaccines and experience we have with coronaviruses in general. So it doesn't come as a big surprise. A booster shot is likely to be recommended at some minimum interval. It doesn't mean that everyone needs to be vaccinated on precisely that time frame from their initial vaccination, but that they don't need a vaccine prior to that interval. When you look at the studies on Johnson & Johnson, over that 8-month period, for some of their endpoints, the effectiveness actually increased over time. So we may well have a different recommendation for boosters based upon whether you got an mRNA vaccine initially or you got the Johnson & Johnson vaccine initially. The big important thing, I think, for listeners and to understand is that primary vaccination is still our strongest tool in the toolbox. And we still have a long way to go. We have almost half the country that's still not fully vaccinated. And that is our best tool, not only to prevent hospitalization and mortality from the Delta variant, but to stop transmission, because every transmission and every infection gives the virus more chances to mutate into who knows what the next variant could be. They really are not making that decision in a vacuum. They are also looking at feasibility, they're looking at the vaccine supply, and are aware of what our obligations are and our opportunity to share vaccine globally. But we have millions of doses of vaccine in the United States that will expire if not given. So that's all part of the calculation.